Hey guys, this is Dr. Sandy, and what I want to do this week is go over some common questions we hear from our patients and my professional response to those. So, number one, when should chiropractic care begin? So, actually, just true story, both of my sons had their first chiropractic adjustment 2 hours after birth. If you look at the research, our intention is to make sure the brain is talking to the body. So ideally from birth and throughout life, the spine should be maintained. We want to keep pressure off those nerves so the organs and muscles are at full potential. You take pressure off the core, the body can heal itself, but it's literally something from birth all the way through. Also technique-wise, I know some patients are concerned, like the way you adjust a small newborn versus an adult obviously would be modified. The great thing about our office, we use very gentle techniques. We can definitely see kids, but kids as soon as possible should be checked because of the birth process, because of slips and falls, but kids absolutely should be checked. Is it bad to crack your neck or back a lot? And my response to that would be yes. I've met patients who've told me that where they do a certain position, they're popping it, and they said it just feels so good. Temporarily it'll do that. Over the long term it actually brings instability to that joint. Usually the people will say they have to pop it even more and more and more. It causes a breakdown in the tissue in that area of the joint. Definitely not something you want to do on a regular basis. If you stretch your body and it happens to happen, that's one thing, but if you're constantly forcing it, that is not a good thing. Can subluxations automatically correct themselves? Now, what you have to remember is with the human body, when people come for a visit, your body is actually adjusting itself. When you're coming to our office, we're going to parts of the spine where the spine was not able to correct itself. We're assisting it, and then with repetition and following a proper program over time, the body can actually keep those positions, and then we see how long we can have between those visits. In the beginning, obviously, we need to do more visits, but over time, just like going to the dentist, we can spread out the visits, but we're getting the major subluxations. The minor ones, the body is actually self-correcting. Can I tell I have a subluxation without consulting a chiropractor? The reality is when you first have a misalignment in the spinal cord, you will feel nothing. But when it stays there long enough, it can affect breathing, digestion, maybe blood pressure, headaches, back pain, numbness, tingling, feeling stressed out, possible anxiety, feeling low. So symptoms we always teach, and we always know the research is the last thing to show up. When you initially have misalignment, you will feel nothing. Is chiropractic similar to massage? Massage is completely different. It's a great healing art, but the intention is obviously to relax the muscle groups. Our intention is to work with the spine, go to the spinal cord, which controls muscle tone and organ tone. So if we can have that in alignment, the whole body can work better. It is not like massage at all. Massage is fantastic. I have no problem with it, but it's a different healing art. Our focus, our training, our education, our specialty is the spinal cord, which controls all systems in the body. Do chiropractors work in hospitals? There are certain hospital settings where we're seeing that more often. I know the Ontario government is now making efforts to have chiropractors in more different health settings, so things are starting to change. That's a newer development we're seeing, and we're seeing again that, physio is fantastic, acupuncture is fantastic, massage is fantastic, and obviously within the medical profession, but we're realizing that when it comes to naturally working with the spinal cord, chiropractors, obviously that's their expertise, and working like a team, great things are happening, but you will be seeing chiropractors in more different settings absolutely in the future, and the government's working on pilot programs with that. And what is the education of a chiropractor? So I'll wrap up with this question. Myself, I did about 3.5 years of undergrad. I went to the University of Toronto, so most of them will do sciences and some of them will do a BA, but you need to do that. After that, it's about 4 years of education to become a chiropractor. The first 2 years, very similar to a medical education, anatomy, physiology. Where it changes in the last 2 years, we specialize in neurology. Usually within medicine, you'll see we're studying of pharmacology. So the first 2 years very similar, but then after that, much more emphasis on neurology, biomechanics, looking at the spinal cord. So I hope it does answer some of the major questions. We will be here next week. God bless, and the best to you and your family.